Hello and welcome back to another Friday yoga therapy class with me, Gisela. Today's practice we are focusing on the lower back, specifically for issues such as disc herniation, osteoarthritis, or perhaps degenerative disc disease. We won't be moving with big ranges today. We're going to keep the movements small and controlled to create strength and stability into our lower backs. Our pace today will be slow and controlled. We focus on moving with ease and steadiness. If you practice yoga regularly, you'll be familiar with sthira and sukham. If at any point you start to feel pain, then perhaps you've pushed too far. You've gone into that big, deeper range of movement. So pull back. If you are pulled back but you still feel pain, if you do have a herniated disc or any of the other issues that we're working with today, come back at a later time or just stop, take a moment, breathe and rejoin when you feel ready. For today's practice, I'm using a blanket, 2-inch thickness once it's folded into a square, bolster, again pillows or cushions. I do have a spongy Pilates ball, but if you have a yoga block, that's also absolutely fine, or perhaps a small pillow or cushion. And we'll be using a chair as well. Kitchen chair, dining chair, anything is acceptable as long as it's not too high off the ground, like a stool or anything. It's fairly low. Okay, we will start our practice lying down on our backs with our knees bent. I'm going to use a blanket for head support, but again, you can lie flat if that feels comfortable. I do suggest perhaps doubling up on your mats if you're on a hard floor, or if you have a rug, perhaps take your mat to the rug so that you feel warm and your back feels supported. Let's come down onto our backs. And perhaps you're using support under your head for your neck. Let's take a couple of moments to become present and aware in your body. We'll take 5 breaths. I'll invite you to keep your eyes open or perhaps close your eyes. Rest your arms down by your side, palms up, palms down, or hands on your tummy. If your eyes were closed, open your eyes and then bring your arms down by your side. We're going to start with some pelvic tilts. No need to lift up. We're not doing bridge yet. We're warming up towards that. Have your knees bent, feet hip distance apart, toes pointing towards the bottom of your mat, short edge of your mat. Arms firmly pressed into the floor, palms into the floor. On an inhale, gently tilt your pelvis towards you, little squeeze of your glutes, and little engagement of your hamstrings. Push your feet into the floor, and then as you exhale, roll your lower back and tilt your pelvis away from you. So inhale as if you're about to lift up to bridge, but you're not. Pelvis tilts towards you. And exhale as if you're rolling down from bridge and you bring your coccyx down last. Pelvis away from you. Keep these movements small. Breathe in. Pelvis tilts towards you. Exhale away from you. Feet pressed firmly into the floor, squeezing into your legs. Your inner thighs towards each other, not away from each other. One more inhale, tilt your pelvis towards you. Exhale, away from you. Come back to a neutral spine. Now, if you have a block or a ball nearby, place the ball in between your thighs. You might have to walk your feet out just a little bit more, but make sure that you're really squeezing into your block or your ball, or a small cushion. It's quite nice to have something that's a bit softer. A block can be quite hard on the edges. Inhale, rolling your hips towards you, squeeze. Exhale, away from you, squeeze. This way we keep our inner thighs engaged, helping with stability. Hamstrings also engaged. Feel the back of your legs working. Just moving through a small range. Inhale. And exhale. Just a couple more. Breathe in. Breathe out. Come to neutral and release your prop. Just pop it to one side. Next, we are moving into supine marches, keeping your pelvis completely stable, feeling the movement as you lift your foot off the floor from your hips, pressing into the floor with your left foot, hover your right foot off the floor. Movements from your right hip, keeping pelvis stable. I'm placing my hands on my pelvis so I can really feel if I start to sway. Strengthen your lower back. And then lower your right foot without moving your lower back and lift your left leg, keeping your pelvis stable, lower back stable. Just move very slowly. As you hover your right foot off the floor, really push your left foot into the floor. Same the other side, right foot to the floor, left foot hovers, really push your right foot into the floor. Continue. I would say make these movements slow and controlled, and don't forget to breathe. You can feel your hips beneath your hands, but you're not swaying into your lower back, staying nice and stable. One more to each side. And release. When we release, we can feel how hard we were actually working. Have a little wiggle of your toes. Maybe just some gentle little heel lifts. Have a check-in. How are you feeling? Now, let's find our ball or our block again. Place between your thighs, and we're going to move into some very gentle bridges. Arms down by your side, feet hip distance apart, toes pointing to the bottom of your mat, the short edge of your mat. And we don't have to hold on to our ankles. Just make sure that you can feel your heels with the tips of your fingers. Squeezing into your prop or your Pilates ball. Gently roll up through your lower back. It's a little tilt of your pelvis. And then lift off, squeezing into your prop. Squeeze your glutes. And then slowly roll down. Exhale as you roll down. Inhale, start with your pelvic tilt and then roll up through your spine, inner thighs, pressing into your prop. Glutes engaged, push with your feet. Gently exhale as you roll down. Inhale, roll up. When you're up, really feel the engagement everywhere. And then slowly exhale, roll down. Lower back, sacrum and coccyx into the floor last. One more time, breathe in, roll up. Exhale, slowly roll all the way down. Brilliant. Now we're going to hold at the top. Inhale, roll up. Squeeze. Perhaps you can walk your feet in a little bit closer. Inner thighs towards each other. Hold here. Push with your feet. Keep breathing. One more round of breath. As you exhale, slowly roll down. Beautiful. Release your prop. Gently roll onto any side and push your way up into a comfortable seated position, where we'll just take a moment, sitting up nice and tall, maybe eyes closed or gaze lowered. 3 full breaths. If your eyes were closed, open your eyes and lift your gaze. Now we will move into standing position. You will need your chair. Placing your chair towards the back of your mat. And if you wish to use your ball or your block, we're going to start to do some chair sits at the chair. Stand to sit. Placing your prop, if you're using one, between your thighs. And that will gauge how close your feet are together using your prop. Inner thighs really squeezing into your prop. If you're not using props, just focus on squeezing your inner thighs towards each other. And then for the first one, you might have to just feel your way. You might sit down and miss the chair completely. So make sure that you are as close to your chair as is comfortable. And then on an inhale, arms forward, little tap, squeeze your prop as you come up. Engage your glutes and quads. Inhale, tapping the seat, squeeze up, exhale. Let's do 5 of these. Breathe in, exhale. Inhale, exhale. Inhale, exhale. Last 2. Fantastic. Release your block. Shake it out. Okay, we'll do another round and we'll increase to maybe 8 squats this time. If you feel that that's too much, take it at your own pace. Placing the block between your thighs, standing comfortably, inner thighs squeezing into your prop, arms forward, breathe in. Just skimming the top of the seat, not relaxing and sitting down into it. Squeeze, exhale up. Inhale, exhale. 3, 4, 5, 6, 7. Last one. Let's hold it here. Squeeze into your inner thighs, your glutes, your quads. Push into the floor with your feet. 6, 5, 4, 3, 2, 1. Exhale as you squeeze and come up. Woo! Brilliant. Okay, let's pop our chair to one side. We will still want to use our ball or block, or perhaps you've had enough and you just want to pop that to one side. Heel raises. Now, heel raises help to strengthen our ankles, our calves, and our core, which help bring stability to our lower back when we're walking or when we're standing. Okay, plus it's very good for balance practice as well. Hands can rest on your hips or arms down by your side, or maybe lift your arms up as you raise your heels and then exhale as your arms come down. Choose which movement and hand placement works for you. Okay, inhale, coming onto the balls of your feet and squeeze your prop between your thighs, inner thighs towards each other. Ooh. And then slowly exhale. Slowly bring your heels down. Okay. Inhale. Squeeze up, squeeze glutes. Slight engagement, navel to spine. And then slowly come down. Wonderful. Breathe in. Breathe out. Breath and the movement can last the same time. Inhale up. Exhale down. Inhale up. Slow exhale down. The slower the movement, the trickier. Inhale. Exhale. Let's do 3 more. Inhale. Exhale. Breathe in. Breathe out. Keep tight. Keep squeezing. Breathe in. Slowly out. Oh, that was a bit faster. Last one. Breathe in. Breathe slowly out as your heels touch down. Fantastic. Okay, let's pop our prop to one side and we're going to come down onto our bellies into Sphinx position. So gently coming down onto our tummies, forearms in front, elbows under shoulders, tops of your feet on the floor. Lifting your chest forward, squeezing your shoulders back. Have some engagement in your glutes. Really push the top of your feet into the floor. Now, if you feel any pinching and this is causing pain, or it's just too much, it's too big of a range, go a little bit wider with your feet and maybe slide your elbows a little bit more forward of your shoulders and see how that feels. If that still feels like too much, then place your blanket with a couple of inches thickness underneath your pelvis. And just elevating just that little amount can really help take any compression or pinching out of our lower backs. Keep some engagement into your glutes and keep pushing your forearms into the floor, shoulders back. Definitely don't want to feel our neck sinking down. We're lifting up and out. Slight abdominal engagement, pulling your navel back towards your spine. Five steady breaths here. Then gently walk your elbows out to the side, slide your hands under your elbows, push up into tabletop. If you were using a prop, please take that out, pop that to one side, and we'll slowly come back down. But come back down, have your hands under your shoulders. And again, notice perhaps you feel more comfortable in your back with your feet a bit further apart, or perhaps you feel comfortable walking your feet in a bit closer or hip distance. So just see how you feel. And we're going to just do some gentle cobras. Keep your elbows tucked in towards your ribs. Engage your abs. Inhale, a gentle lift. No need to throw our head back and up. Look forward, strengthen your shoulders, and then slowly exhale, forehead to the floor. Breathe in, lift up. Slowly exhale. Inhale, lift up. Slowly exhale. Inhale up. Exhale. One more. Inhale. See if you can hold it for an exhale. Breathe in again. And slowly exhale down. Stack your forearms. Perhaps rest your forehead on your forearms. Wiggle your legs. From here, slide your hands under your shoulders, engage abs, tuck your toes under, and let's push up into tabletop. Coming into your tabletop, if you want to place something under your knees, please feel free to cushion your knees, which I'm going to do. Knees under hips. Wrists under shoulders, inner elbows facing each other. When we do cat-cow with any lower back issues, extension is okay. We're not going to really sink and lift our bottoms up. So just a gentle extension, head forward, keep a little engagement in your abs. And then on the exhale, instead of rounding too much into cat, come into a little bit more of a neutral spine, chin to chest. Inhale, cow. Exhale, not so much cat. As you exhale, navel pulls into spine, but we're trying to keep our back a little bit more neutral. Breathing in to cow, exhale. One more time. And then release. Another stability practice, bird dog. So just slide your right leg back, right toes on the floor, push into your right heel, engage your right leg, and then float your left arm alongside your left ear. Now from here, you can keep your right foot on the floor if you'd rather. Otherwise, just gently lift your right foot off the floor, squeeze into your glutes. Hold it here. Two more breaths. Your right leg does not have to be very high. Last breath. And as you exhale, bring your left hand and your right knee back to the floor. Okay, gentle movements. Swing your hips side to side. Left foot steps back. Keep your left toes on the floor. Push into your left heel. Navel to spine. Squeeze into your knee. Right arm alongside right ear. And then option just to stay here or gently lift and hover your right foot off the floor. If you feel your left hip, sinking, lift up. Two more breaths. Gently bring your right hand and your left knee to the mat and move your hips from side to side. From here, we will make our way into a mini Shavasana using any support that you wish to use today. Support for your head, support under your knees, or perhaps a blanket to keep you warm. Placing something under the knees is much better if you do have anything going on in your lower back. Making sure you're comfortable. Making sure your lower back feels comfortable. Shoulders, head and neck. Hands resting on your tummy, or maybe arms are down by your side. And we'll start our rest today with 3 magic breaths. If you've not done the magic breaths with me before, I'll explain first and then we'll start. So we're going to repeat a breath 3 times. First one is you breathe in through your nostrils And make an audible sigh out through your mouth. We'll do that 3 times. The second one, breathe in through your nostrils. And then we exhale, whistling out our breath. We do that 3 times. The last one, breathing in through your nostrils and then making an S sound through our teeth. And we do that 3 times. So making sure your hands and arms feel soft and relaxed, your legs, your feet and your ankles relaxed, your face soft. Take a couple of normal breaths. Breathing in through your nose and then making an audible sigh out through your mouth. 2 more times. Second round, whistling out our breath, breathing in through your nose. Two more times. Last 3, S sound. Inhale through your nose. S, your exhale. 2 more times. And rest. And gently bring your hands, if they were down by your side, and place them on your tummy. Feeling your breath beneath your palms. Bring some movement into your toes. Maybe just stretch your legs. Bending your knees one by one. rolling any props or pushing any props away from you, and gently rolling onto any side. Staying here for a moment, rest your head on your arm. And then coming up slowly into any seated position. Perhaps your eyes stay closed. Perhaps you open them. Sitting up tall. Taking time to check in. How are you feeling? Do you feel some relief? Do you feel you've created some space in your lower back? Take a moment, breathe and observe. And then when you're ready, if your eyes were closed, open them, lift your gaze. Thank you for joining me today with your practice. I do hope that you found this class beneficial, especially if you are experiencing some lower back issues, particularly the disc herniation, degenerative disc and osteoarthritis. And perhaps there were some specific movements that you felt really did give you some comfort and some release, that you can revisit this class anytime you wish. Have a wonderful weekend, and I will see you next Friday.